Hi, my name is Kylie Grabenstein. I'm in the Family Nurse Practitioner program at EKU, and I did my integrative review assignment on reducing the risk of cardiovascular disease through exercise and nutrition. This topic was really important to me because I work on a telemetry floor, so I see all kinds of people come in with cardiovascular disease, people who didn't know that they had it, new diagnosed. People who didn't even realize that they could have possibly prevented it, and people who don't even realize there are ways to prevent the exacerbation of cardiovascular disease. So, to go over some statistics, cardiovascular disease is actually the most common cause of death in the world. In America only, around 610,000 people die of heart disease each year, and that's averaging 1 in every 4 deaths. More than 90% of heart attacks could have been prevented. There are 9 modifiable risk factors that can prevent a heart attack. That is elevated lipoprotein, smoking, psychosocial factors, abdominal obesity, hypertension, insufficient daily fruit and vegetable consumption, physical inactivity, diabetes, and alcohol consumption. The big ones that I focused on for this assignment was the physical inactivity and the abdominal obesity, and insufficient daily fruit and vegetable consumption. So study 1 that I picked was a randomized controlled trial. The purpose of the study was to evaluate this thing called EKU to reduce cardiovascular risk. So EKU is a 12-week group session of 3 hours educating on physical activity and nutrition. So in the sample, there were 185 men and women, each aged 35 to 70, and each of them had at least 2 cardiovascular risk factors. Those were systolic blood pressure over 140, diastolic blood pressure over 90, LDL over 4, A1C over 7, a smoker, and BMI over 30. The exclusion criteria was coronary artery disease, heart failure, renal insufficiency, stroke, and diabetes type 1. So in this study, there were 3 different groups that were randomized. There was the intervention group, which was the EKU, which I said was the 12-weekly group session of 3 hours educating on physical activity and nutrition. There was the specialized clinic group, which was a group that was seen by medical specialists at inclusion and at 24 months. So whenever the study started, and then they were seen again at 24 months, and that was it. And then there was the control group, which that group just saw their primary care providers and went to their normal doctor visits that they normally would go to. The results showed that the cardiovascular risk actually decreased from 16% to 13.3% in the EKU group. That was measured by the Framingham risk, which is the cardiovascular risk within 10 years. And with physical fitness, the EKU group showed a greater physical fitness results in 12 weeks than the other 2 groups. In average body weight loss, the EKU group lost an average of 2.9 kilograms, while patients in the other groups remained the same. So in that study, it kind of showed that having group sessions teaching about physical activity and nutrition could make people a little bit more motivated maybe to go out and actually follow the nutrition and exercise guidelines. So the second study was a randomized controlled trial also. It was to evaluate the effects of 5% weight loss through diet and exercise on lipid profile, inflammation, and endothelial function in obese individuals. So the sample was 48 obese adults aged 22 to 41. To be included, they had to be previously sedentary. They had to have a BMI of 30 to 39.9. The exclusions were use of drugs, active smoker, hypothyroidism, diabetes, grade 2 obesity, arterial hypertension, anemia, active infection, and cancer. So in this study, there were 2 different groups. There was one group that was diet only, and then one group that was diet and exercise. For the diet only group, there was a diet plan that was calculated to provide a reduction of 500 to 1,000 calories per day, and then somebody came in and counseled them about the diet plan. In the diet and exercise group, there was the dietary counseling, it was the same thing that the diet group got, but they also went in for physical training 3 times a week. They were supervised, and they were on a stationary bike for 45 minutes at a 70% intensity of heart rate reserve. So the results of this showed that the time required for reduction for 5% body weight was 79.7 days on average for the diet-only group, and 65.9 days on average for the diet and exercise group. The total cholesterol decreased drastically in both groups, and the triglycerides decreased significantly in both groups also. So I thought this study was pretty important because one of the big risk factors for cardiovascular disease is obesity. So I thought this study kind of showed that diet and exercise together can reduce body weight faster than just diet. So I think it's really important to educate nurses, nurse practitioners, PAs, doctors about these types of studies, because it shows evidence-based practice showing what could prevent cardiovascular disease and what could prevent the comorbidities of cardiovascular disease. And by educating the doctors, educating the nurse practitioners, nurses, all that kind of stuff, they can kind of trickle it onto their patients, educate their patients, educate them on the risks. Whenever a patient comes in for a yearly physical, if they have these risks for cardiovascular disease, kind of tell them the statistics, like the amount of people that die from cardiovascular disease, and the 90% of heart attacks is prevented by some of these risk factors. So by providing pamphlets to patients, posting posters around hospitals, posting them around doctor's office, especially in the waiting rooms whenever people are in there waiting, and the clinic rooms whenever people are waiting for the nurse practitioner or the doctor to come in, they can read these. They can read about healthy lifestyle choices, such as a balanced diet. They can read about different aerobic exercises they can do, such as swimming, stationary bicycle, elliptical, running. During yearly physicals, we can kind of pick out the people who could be at risk and let them know, hey, you're at risk. This is what you can do to prevent a heart attack. We can give them a diet plan, an exercise and diet program, because I feel that if people have a prescribed program, they're more likely to follow it than if they were just told like, hey, exercise, diet. This way they're a little bit more likely to follow an actual program and follow it the right way if they have like something kind of written out for them on how to diet and exercise. So hopefully these studies kind of help a little bit. They help us kind of see what can be done to prevent cardiovascular disease. Hopefully we can teach our patients and prevent some cardiovascular disease in the future. Thanks. Bye.